Good afternoon. My name is Camilla Williamson and I am the Healthy Aging Advisor at HelpAge International. But I'm talking to you about an evaluation that I did of a program of HelpAge in 21 before I joined HelpAge. So the project that I evaluated and that I want to share with you today is the SANA Phase 2 project. This was a project which built on HelpAge work expanding the Older People's Association model in the region and learning from the intergenerational self-help club model that we've heard about already from Vietnam, which was part of a project in SANA Phase 1. The project goal for SANA Phase 2 was to improve the well-being of older people, their families, and their communities in Asia through resilient and self-sustaining older people's associations and improved social protection. So the project very much included working on both health and care as well as social protection. But today I wanted to focus on the Older People's Association and the model for sustaining OPAs and community-based organisations. So I first of all wanted to just give the brief overview of the model that was used for the project and for developing resilient and self-sustaining older people's associations. And it took a two-staged approach. Stage 1 involved the development of strong and sustainable models. There was various criteria for this. The first was that OPAs were based at village level in order to reach older people at the grassroots level and their communities. They were community-led from inception for rapid capacity building, strong local ownership and adaptive planning by the OPAs. They were intergenerational, and this was to ensure relevance to the community, broad links and wider support base, for example, for volunteers, technical support, and also to bring in diverse skills and perspectives. They were multifunctional, so including a range of different activities to ensure the relevance to the lives of the members of the OPAs and to improve well-being holistically. And really critically, they were designed to be sustainable from inception. So this includes financial sustainability, but also management capacity and institutional linkages. So the second stage was focused on support for replication of the OPAs. This includes a simple set of training materials and management tools, which were standardized for each country context. It focused on evidence of impact of OPAs, on the well-being of its members and the wider community. A key element was demonstrating value for money, including a social return on investment. And it importantly involved ongoing engagement with key stakeholders who can support replication. And this was really stakeholders from the grassroots level to the national and international levels. So the evaluation drew out a number of different areas of impact that I'll briefly go through. All of the project documentation and the final evaluation really clearly showed that the ambition to successfully replicate and strengthen OPAs was achieved. In Bangladesh, Cambodia and Indonesia, 49 OPAs were formed and a total of 372 in Vietnam, really recognising that this was building on a model that already existed in Vietnam. And OPAs scored very highly on their ISHC quality matrix that was developed. All of the evaluations and the various different reports that were produced throughout the project really showed the high relevance of the ISHC model for building and initiating strong and sustainable OPAs in the study countries and those different contexts. And they also showed the positive outcomes for older people. And this included in relation to health, income generation, more effective care in the community, but also voice and empowerment and supporting older people to be agents of change, which is what I want to focus on today. So multiple reports throughout the project period, including action research, reviews, short briefings, and also the evaluation, all illustrated various strengths and key factors for success and sustainability. And I wanted to include these here so that they're there for you to go back to. But I'm not going to run through them individually. But as I say, I will share various different resources at the end so that you can look in more detail. But what I really want to discuss today is the change process. And many of these aspects come into the change process, as we'll see. So what was the change process? So alongside looking at output and impact, The donor for the project was really keen to draw out in the evaluation the pathway to change of the project and exactly how that happened. And from my perspective, this was a really interesting and useful part of the project and its evaluation. And it was a real privilege to be able to talk to those engaged in the project, including staff, older people, wider communities, to really understand both the individual level changes that occurred, but also the collective changes and the process for those changes through the OPAs that were established. And I think, going on alongside this, I'm aware of the voice-related elements. And I thought it was useful to highlight, I worked on the voice framework for HelpAge with colleagues. And this was very much based on how HelpAge and network members work and how they support older people's empowerment, including through OPAs. And what was interesting was through this change pathway and exploring it as part of this project, the pathway to change that emerged through the evaluation really reflects the voice framework too, and they both very much reflect each other. Originally, I looked at the individual and group pathways to change, but actually what emerged was really intertwined. So what I'm presenting is very much the one for individuals, but also the one for OPAs as a whole. So the change pathway that emerged really highlights the journey from engaging and motivating community members and building solidarity and commitment among members, and then supporting them to be informed and empowered through building community capacity and demand, which then led to individual and group action and creating or claiming space for government or citizen interfaces that enable older people's voices to be heard, the issues affecting them to be understood, and for their demands to be responded to by power holders. So really in that last phase, strengthening voice and accountability. But I want to unpack each of these in a bit more detail and talk about some of the critical elements involved in each that emerged. So firstly, the step of engaging and motivating. And key inputs for this that came out included having that set approach and standards, including critically financial sustainability. This was seen as something really important for engagement and motivating people to continue to engage. The diverse activities with tangible benefits also came through as very important, and building understanding of the model among key stakeholders, including club members, but also communities, wider service providers and government. There were multiple stories of people or communities not really understanding what the OPA was and what it was going to do at the beginning, hesitancy to join or, skepticism towards its activity from others. But that by showing by doing and increasing the visibility of the activity that the OPA was doing in community really led to more understanding and that community buy-in, which was critical to the formation and strength of the OPAs. Also taking an inclusive approach, so the intergenerational diverse membership in terms of age, disability, socioeconomic status, and trying to reach more marginalised groups. The second element in terms of building solidarity and commitment included various different aspects. So the monthly meetings and the clear understanding of expectations for contribution from members, but also the benefit that they would get out was said to be really important. Equally, the strong and transparent management process seemed to be key to building trust and commitment to the model. And this was very much the case too, alongside the financial transparency and that self-sufficiency, which seemed to be important for trust and solidarity and commitment. Also, and this comes through from all of the different documents that you'll find on OPAs, they're fun and enjoyable activities. People really enjoyed them. There was laughter. Always people reported this, and they really promote friendship and happiness through the kind of activities that they're involved in. Then there was a stage around informing and empowering, and this really seemed to be a process of providing information, advice, supporting learning, and then training and doing. So that cycle to build up capacity. It wasn't just about provision of information. It was about supporting it to be embedded through learning and doing. Creating and claiming spaces for people to come together was really important. And also within those spaces, promoting shared decision-making and problem-solving. A lot of people talked about the equality and equitable approach, everyone's voice being important and everyone being consulted in making decisions collectively. And that really seemed to strengthen capacity of individuals and also the OPAs together. And in that way, the importance of taking a community-led approach from the beginning, which seemed to support individual and group action. Lastly, all this led to strengthened voice and accountability, and really important thinking about it from the demand and supply side approach, by which I mean, the demand that older people in the community, increasing their capacity and demand for accountability, but then engaging stakeholders and power holders and addressing their understanding and their capacity to respond. So that's demand and supply side. So building strong networks between those different stakeholders and older people's associations, building the citizen capacity and demand, as I've said, and claiming or creating space and opportunities for state and citizen interface. So having meetings with stakeholders, service deliverers, power holders, and using those to really hold power holders to account and getting responses from them. And this was key to lots of different outcomes. So in health, for example, bringing local service providers to hear older people's concerns, and they would go away and respond to them and think about how they could respond. And then those relationships will build, and that was key to sustainability, not just in those areas but in others, because once you've created those relationships and those spaces, they can last beyond the project. So to highlight the impact of this and that process, I've just included this quote from one of the chair people in the OPA in Bangladesh. He said, "Now we do know many things about services, such as how to keep good health, about rapport building, to identify the problems of the community and ways to resolve the problems together. We could not imagine it ever. We had only to depend on the government's support for reconstructing the road, but now we are doing such work with the support of community people through collection of money and resources, as well as negotiating with the local government for our betterment. So we came to know the different things from here and getting value and recognition for good work from various entities of the society and administration." So I really think that speaks for itself and highlights that change process from engaged and motivated to engaged to strengthening voice. So I just want to finish just a few reflections. The approach really, I think, shows how older people can be supported to be agents of change. They are already, but how that can be amplified, and supported to take the lead in their own and others' development. And there was clear evidence for how this can be replicated and strengthened in other settings. The strengthening of the demand and supply side accountability was clearly central to securing meaningful change in multiple contexts and in different areas, so social protection, health, etc. And I think what was really clear was the role of the network approach in promoting strong partnerships, joint action and shared learning. And this was true between OPAs within countries or in local areas, but also between countries and then across HelpAge. And I think this is a really promising model and learning for the future in terms of the HelpAge network and us all working together. And it takes time. I think a clear lesson that we see repeatedly from these exercises is still more to do to build government capacity and commitment to OPAs. In terms of challenges and opportunities of COVID-19, you'll read more about this in the full report, but it clearly presented a lot of challenges, but there was also opportunities to showcase what OPAs are able to do and how they can respond. But they also highlighted new challenges. How can we support people engage with digital technologies? And I think finally just wanted to reflect that I think strategically the OPA model and the multifunctional approach really aligns holistically with approach to promoting dignity, well-being and voice through grassroots to global linkages. So thank you so much for your time listening today, and just to reiterate what an honour it really was and insights gathered from speaking to colleagues who've been working on this for so many years and older people as part of this evaluation. And it's really a testament to the diverse activity and learning that there is and the incredible work going on. So I'm really pleased to be able to speak to you today, and it will be great to have a discussion. I've also just included some further reading and links to the evaluation report and other bits and pieces for more information. Thank you so much.